Dallas Methodist Medical Center is making security changes after 2 hospital employees were murdered there. Other hospitals are reviewing their security procedures as well. This is not a new concern for many of our area's largest hospital campuses where people come and go at all hours. Fox 4's Sean Rabb taking a look at security challenges for hospitals. Sean.
Yeah, and what we learned today, locally and nationally, an increase in violence against healthcare workers, attacks against healthcare facilities. And after the 2 healthcare workers were killed here at Methodist Saturday, area hospitals are in fact now doing self-examinations of their safety measures.
Hospitals have always had plans to detect and deter violence in hospitals.
Even more so since Saturday's shooting inside Methodist Hospital's mother's baby unit that killed 2 innocent women, a nurse and a social worker.
We try to monitor the entrance and exits and the intake places of a hospital or an outpatient clinic or even in a medical office building. And by monitor, I mean have security people in place.
Methodist Medical Center making security changes. Visitors must leave by 7 p.m. and can only enter through 4 designated doors. All doors will be locked after 7 p.m., except the emergency room, and Methodist recruiting more officers.
We do have metal detectors, hand wands, that we can move different locations as needed.
Dallas County Hospital District Police Chief Marlon Sewell oversees 111 police officers for Parkland's main campus and 15 community clinics. Emergency rooms here and nationwide are, it seems, the epicenter of violence.
Most of the time those situations didn't start here, but they could end here because people are here seeking some type of medical attention. We have a high volume of workplace violence here, sometimes just because of the people that come on our campus.
6 months ago, Parkland began risk and vulnerability assessment, bringing in third-party security consultant Force Protect.
We're basically looking for the holes in the cheese, for lack of a better term.
Active shooter training is procedure for all hospitals now.
Active shooter might be a low likelihood, but the impact of loss can shut down operations, so it's worthy of attention.
And while some security systems are hidden from obvious view, Finley says some should be highly visible.
There are more passive and aesthetically pleasing systems out there that you can put in place that a patient wouldn't even know they're undergoing any kind of screening. But it's also not bad sometimes, based on risk, to put measures in place that are in your face, because those form a visual deterrent.
The challenge? Creating ways to prevent hurt in places where people come for help.
And at the same time, provide a welcoming atmosphere for family and friends to visit. I do admit it's a very delicate balance.
And of course, we certainly understand that. Now, Frank Finley, Force Protect, says since 2020, since COVID, there's been this increase in this aggression. And because of that, hospital administrators, he says, are more readily now to accept safety recommendations than they might have been in times past. Received an email statement from Baylor, Scott and White today without mentioning specific safety changes. They said to us in part, and I'm quoting now, "We are reinforcing safety measures and emotional support offerings across our health system." Big challenge for big hospitals and small clinics.